The field of nursing. Nursing is the largest part of the medical field. It is what I'm studying to become. Most of y'all might know what nursing is. Some of you may not know what they do or all they do. The American Nurses Association, on their website under Consider Nursing, defines nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy of care of individuals, families, communities, and populations. Curriculum. There are 2 degrees you can get to become a nurse. You get a Bachelor's of Science degree, which is a 4-year degree, or you can get an associate's degree, which is 3 years, depending on where you go. At TWU, they offer the Bachelor of Science degree to become a nurse. They require you to take 25 hours of basic classes that are required to get into the nursing program. At NCTC, they require you to take only 7 hours of classes that are required to get into the nursing program. Coping. Most of you know what coping is. Most of you usually might have to deal with a situation, maybe at work. You might have something new pop up, something you might have to change the plan up a little bit, so you have to cope with it. And on dictionary.com, they define coping as to face and deal with responsibilities, problems, or difficulties, especially successfully or in a calm, adequate manner. Coping can either be positive or negative. Positive coping techniques are used to reduce tension, stress, and anxiety. Examples are deep breathing or relaxation exercises. For example, you could do yoga or Pilates after work if you had a rough day in the hospital. Marjan Law and Nazrin El-Rami did a cross-sectional study of 100 nurses in 2 different hospitals, Towhide and Bisat. They are both in Kurdistan, Iran. The results for positive coping came out at a good 19%, a moderate 51%, and a weak 30%. Negative coping have the opposite effect of positive coping. They are disputing, profanity, or insulting, shouting, drug abuse, or suicide thoughts. The negative coping stats that came out as a result was a low 22%, a medium 29%, and a 49% for the high usage of negative coping. Lynn Purdue is a nurse at Denton Regional Hospital in Denton, Texas. He has a BSN, got it at University of Texas at Arlington, and what they use is a dark sense of humor to cope with everything they deal with. I believe that is a positive one because it doesn't implement harm to yourself, but it helps you get through the day, even though there's lots of suffering that they see. Lots of things going on. And then young nurses, the ones that are new to the job, have never experienced what a veteran nurse has or seen. They're probably excited because they've been working 4 years, 3 years to get the job as a nurse, to get all the requirements, all the knowledge built up. And the biggest shocker for a young nurse is the reality of how intense the situation can be. They're not used to the fast pace of working 1 patient or 2 patients at the same time with two different diagnoses, and it can be nerve-wracking. The typical workload of a nurse is 2 patients per nurse. The more intense or more traumatic a patient is, the more nurses that patient will receive. The typical work hour is 12-hour shifts, 8 in the morning to 8 at night, or 10 in the morning to 10 at night, so on. Nurses are constantly working. They rarely have a break throughout the day. They're constantly filing paperwork for the patient, so that way they can get that patient out of the hospital as quickly as possible. As I said earlier, nursing is a fast-paced occupation. They have to constantly think on their toes. Some people are just gifted with thinking on their toes, that they can just think of something just like that. Some people are not quite as lucky, and for a nurse to think on their toes, to get it under the belt, to where they can just do it, just a snap of their thumb, it takes about 6 to 12 months to keep their mind straight. Because they know that they've learned a lot, and there's a lot that can go on, and many things can go wrong with the patient. So they have to keep it straight. It takes about 6 to 12 months.